Hello, my name is Nolan Gukazel. Today we're going to be going over the sterile glove competency. So the first thing we want to do as we enter the patient's room is we are going to want to wash our hands for 15 seconds. Okay, after we wash our hands, we're going to want to check that the table is at waist height. We want a firm surface. This bedside table will be perfect. We're going to want to disinfect this table with our disinfecting wipe. All right. We're going to wait for that table to dry before we do anything else, and we're going to re-wash our hands for 15 seconds again. Okay, now that our table is dry and our hands are clean again, we're going to go ahead and take our sterile glove packaging. We're going to want to check the expiration date of the package and the package's integrity, making sure there's no rips or tears. So we can go ahead and open our package. Lay flat and using just the tabs to open, maintaining the sterile field on the inside. We're going to pull taut and lay flat. Okay, so now with our non-dominant hand avoiding crossover, we're going to go ahead and pick up the inside cuff of the glove. We're going to pick up, stay away, making sure our hands stay above the level of the sterile field, and we do not lean over the gloves, contaminating them. So now with our dominant hand, our sterile hand, we're going to go underneath the cuff of the sterile glove. Underneath the cuff. There we go. Pick up, away. Push our hand in. Okay. Now our gloves on. It's not completely on, but now that we have two sterile fields, we can go ahead and help interlock our fingers to get the gloves on. Pinch the cuffs as long as it's sterile to sterile. So now we do our procedure. Once our procedure is done, in order to take the gloves off, we're going to pinch the palm of our glove and remove. And then with our clean hand, we are going to go underneath the cuff of our second and pull. Since these were used in a procedure, touching the patient, we can go ahead and dispose of them in the biohazard. And we could clean up the rest of our materials, throw them away. And then we can go ahead and wipe down our workspace one more time with a disinfecting wipe, dispose of that. All materials are disposed. We're going to wash our hands one more time for 15 seconds and we can exit the patient's room.